Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and welcome to another fascinating, entertaining, and interesting episode of Plastic Surgery Uncensored. This week, we're going to talk about the most common plastic surgery myths. At least they are to me. We're going to talk about the most common things people are sold in plastic surgery. I refer to it as the snake oil and or the wishing well of plastic surgery. There are four key things in plastic surgery that we have yet to figure out. When we do, my God, will we have arrived. But as of now, in my humble opinion, we have yet to get anywhere near the outcomes we would want, and that is being advertised. So what makes something a myth? It's when you say it's something and in reality it's not. So in plastic surgery, there's a massive component of salesmanship, marketing. Remember, we as practitioners and providers are selling you on treatments with the intention of creating a result. That's the basic principle. We tell you we have something to offer you. You say that sounds enticing because you want the result that we state it can provide. So if it doesn't actually provide the outcomes we suggest or we perhaps sell you on, then I think we're nothing less than selling snake oil. And I feel strongly that we are doing a disservice to patients and the community at large. So what are these four, I call them the pillars of plastic surgery? What are they? One is skin tightening, non-surgical skin tightening. That's right. When we can use a machine, a cream, a lotion, a potion, or something to tighten loose skin. Can you imagine the applications of such a device? The neck skin, the eyelid skin, the sagging brow, the excess skin on your belly, the sagging breasts, the flappy arms, the inner thigh loose skin. That list goes on and on and on. But I am sure if you are into or interested in plastic surgery, you see devices advertised or claiming to tighten skin all day long, all over the place. Another one is removing of scars. Oh my God, if we actually had a device that removes scars, that's C-sections, gallbladder scars, traumas, dog bites. The next one is the dreaded cellulite. How do we get rid of cellulite? And last but not least, stretch marks, whether that be it from pregnancy, hormonal growth spurts, etc. So I'm going to dive in a little bit and I'm going to show you or explain to you why I believe these four super important topics are we have not arrived, and why as a consumer / patient you have to be incredibly skeptical and savvy and knowledgeable as you seek these treatments. So skin tightening. So the holy grail often in plastic surgery is excision and operating, cutting out, removing facelift, breast lift, removing eyelid skin, tummy tucks. We are constantly trying to remove excess skin in order to tighten the body part that we're dealing with. Thus far, we have really, in my opinion, done an amazing job of figuring out how to do that for the most part surgically, that is, operating on you. But for many, the idea or notion of having a surgery is daunting, expensive, frightening, too much downtime, and too risky. So there is a massive, and I mean massive, demand to come up with a way to tighten skin without ever having to undergo the knife. That sounds incredible. I can tell you for a fact that if such a treatment and or device existed, I, Dr. Rady Rahban, would buy 15 of these devices. I would hire nursing staff, medical assistants. I'd have massive clinics around the country, and I would never come to work again. I'd be chilling with my son and my wife and hang out and go to Montana. Am I crazy? You think I want to operate hours and hours if I have a machine that's going to give you a similar and or slightly less but a good result? So clearly no such device exists, because then every surgeon would have it. So what the hell are all these devices that are being advertised? So this is the problem. The problem is we're not there yet, and people want your money. There is a massive, massive market for people who don't want to have surgery and want skin tightening. So there are lasers, there are creams, there are non-invasive machinery, there is liposuction with heat. There's a multitude of methods and treatment modalities, the idea of which is to tighten skin. I genuinely and humbly believe none of them come even close. Now, if they did somewhat a pretty good job and not as much as surgery, then you could say, well, shit, I'll tolerate that. If it's 50% is good, that's pretty damn good for no surgery. But I would bet at best it's 2 or 3%. No one's going to tell you that. But wait a second, Dr. Rahban. I have seen some incredible before and afters. The world of photography. There is no one policing this crap. A before and after is so easily manipulatable. From as simple as changing the lighting, changing the angle, changing the positioning of that patient, to as unscrupulous as Photoshop. There are 1,000 ways to manipulate a photograph to give you what would seem like to be an incredible post-procedure result. So I caution you, if you are reading a magazine, if you're watching TV, if you're on social media and you see some magical device that's tightening skin, you better double check, because I almost certainly don't think it works. The next huge category, oh my God, I mean, this is such a major category, is scars. Removing scars, get rid of scars, surgical scars, traumatic scars, C-sections, gallbladders, burns, dog bites, falling off of a ladder. Can you imagine the 7 billion people in the world, what they would do if there was something, I don't know, a laser, some kind of cream or ointment, anything that would remove a scar? Again, I would have 100 of these devices or sell this stuff every day. You think your doctor or the guy that's on your social media feed is the only one that has this miraculous device? Only they have it? Nobody else in the world has it? Come on now. So scars can never be eliminated. So anyone who knows me knows my philosophy on scarring, tummy tucks or breast reductions, etc. 49% of your scar is your genetics. 49% of your scar is the person who closes you using a technique, how many sutures, how deep, how many layers, what size, how much tension. That leaves what? 2%. 2% is all the nonsense, the magic that you do afterwards. I do not believe any of this garbage works. I definitely don't think the lasers that people are doing work, at least certainly not to make an ugly scar become nice. Oh, but I've seen some before and afters are incredible. They show me a 6-week scar, and then they lasered it, and at 1 year, it was like barely visible. Yeah, because that scar was going to become invisible anyways. I mean, scars get better over the years. So I just don't buy it. What does work, and I've said it over and over again, are a handful of things that have science. Guys, we live in an era of science. There should be no guessing. There should be no sort of. It should be like scientifically proven, double-blind studies, blah, blah, blah. So massaging, what the hell are you talking about? Yes, digital massage. Putting pressure on scars causes the collagen fibrils, the fibroblasts to become organized and linear and line up and flatten. But massaging is like free and it's really so unsophisticated. Yep. Gentle massaging of all scars will flatten them and make them incredibly good. And then there is some argument that silicone in some form or another, whether it's strips or liquid, does help. But that's pretty much it as far as I'm concerned. I don't really think any of else does anything else. So don't go buying gallons of all this nonsense you see online. Please don't go spend thousands of dollars at your dermatologist getting lasered. Maybe the laser will help with the pigment, but sure as hell not going to take a keloid and make it flat. And by all means, please listen carefully. Do not go and get steroid injections. A tiny amount of steroid may help, but when you go get steroids injected with the intent of causing your scars to flatten and go away, you destroy the surrounding tissue as well as the scar, thereby which making the whole area messed up. Go and get your scar excised and closed beautifully by a skilled surgeon, and you should hope that your scar will be tolerable and reasonable and look good over 24 to 36 months. You must be patient. All right, so we're going to take a break, and we'll dive in and talk about the two other key things you got to be careful with after this break. Welcome back to the second half of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. So what are we at now? So we talked about skin tightening. We talked about scars. Oh, yes, Cellulite. Oh, my God. I wish I had stock in all the Cellulite companies. What the hell is cellulite anyways? Cellulite is a genetic condition in which your skin is puckered and there are these little connective tissue septi, which are little tissue connections from your skin down to your muscle fascia. And so they just pull in just a little bit, creating these little divots, which in and of themselves are not a big deal, but then disrupt the smoothness of your skin, often in the thighs and around the buttock area. And they're undesirable. So naturally you want them gone. Yet another area where there are millions of dollars being spent, millions is a wrong term, trillions of dollars being spent on hokey pokey, nonsensical, never proven science treatments, from rollers, just women rolling the crap out of their skin, to creams, to lasers, etc. Again, let's go over my basic philosophy. If a device existed, it was scientifically proven with exceptionally good results, would I not buy one? Would I not buy 5? Do you know how many people in the world are affected by cellulite? Like 1 in 5? Some crazy number? I'd be a rich man. They don't work. Now, the objective of improving cellulite is to release those septae, cut them, and then fill in the gap so they don't reconnect and push the volume out. That's the idea. And you might be able to improve a single cellulitic area, like a one dimple, and make it a little better. But I don't think you're going to go and make hundreds of cellulitic dimples disappear with any major effectiveness using any one of these treatments. Putting filler in, putting fat in, using laser, lipo, this, that. Those treatments have not been proven. Now, let me preface all of this stuff that I'm saying. I'm referring to excellent results where you and I would both look at it and be like, wow, that looks really good. That skin really tightened. Wow, those scars really faded. Oh my God, the cellulite is almost gone. I'm not talking about a 2% improvement. I'm talking about a major improvement. I think that's what patients expect when they spend this kind of money. And I think that's what they expect based on the photos that are being shown as the marketing material that's being fed to them. So we expect that as people from these companies. And I really don't think the cellulite procedures do anything. And the last of this group is stretch marks, which goes back eons and eons where people wanted to get rid of their stretch marks. What is a stretch mark anyways? A stretch mark is akin to a rubber band that you pull, and then the fibers inside the rubber band snap, and then they don't go back. The rubber band doesn't go back to where it was. And so within your skin, you have dermis, that's the deeper layers. And due to either expansion during pregnancy or growth spurts during hormonal changes, like when you're an adolescent to a teen, the skin stretches, the dermis ruptures or breaks or tears, and the skin becomes thin and has this sort of streaky look to it. Naturally, in some people, it's very unsightly and it bothers them and it makes them insecure. So we want this thing gone. That also is $1 trillion business. And what am I going to say? I'm going to say if there was a machine, a laser, a cream, a lotion, a potion, a roller that makes stretch marks go away, wouldn't I have this stuff in my office? I'd have tons of it in my office. Stretch marks are different than scars because scars are through and through, and stretch marks look like scars, but they're a different kind of internal trauma to the skin. Nevertheless, they are subject to the same limitations that scars are. And so, what is the point of this myths segment? The point of it is don't waste your money. The point of it is that these companies and these practitioners are taking advantage of you consumers and patients in your vulnerabilities and your insecurities. There is no person in the world with loose, saggy skin under their neck with a bunch of scars and cellulite and stretch marks who wouldn't love to have that improved and be willing to take hard-earned money and make it go away. But the fact of the matter is none of the results, in my opinion, that they demonstrate on their marketing material is realistic and actually going to happen. And so as a result, I just felt compelled to have this segment because I want you to be careful. If you're okay with a very minor improvement, then okay, go for it. See what happens. But I would say most of my patients are so disappointed when they come in after having spent so much money and really at the end realizing very little has happened. All right, I think that's the end of my rant. As always, I hope you enjoyed this segment of Plastic Surgery Uncensored. Share this with anyone you think might find it interesting or fascinating. Download, subscribe, and tell your friends all about our podcast, Plastic Surgery Uncensored. Until next week, I'm your host, Dr. Rady Rahban.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.